Let's start today. I'll be discussing some of the rare remedies of cough which I have found very useful in my practice. But if you have any questions, I think you can start first with the question, then we'll do something about the rare remedies. Yeah, I hope people join in early so that we can start a practice. Welcome, Dr. Harshal, Dr. Meera. So, in homeopathy, it is a very important thing to understand. The symptoms are very important in acute cases where what the patient is telling, how the patient is telling. Welcome, Dr. Anja. I hope everybody joins in quickly so that we can start our live. Yeah, good afternoon, Dr. Amit. So, there are few remedies which are very useful in cough, and sometimes rare remedies, common remedies also have some symptoms which we have never seen in our practice, but they give us very good results. Today I'll be talking about some rare remedies of cough. For example, I'll first start with a very important remedy, the remedy which basically has given me very good results in my practice, and I would like to share that with you. Yeah, welcome Dr. Vishal. Okay, I'll just wait for a minute before we start. In the meantime, if you have some questions, you can ask me. Dr. Paresh, welcome. The remedy I'm talking about is mentha, that is peppermint. Now, peppermint, as you all know, that we have seen, we have eaten peppermint also, and we use in cooking also. It has some symptoms which are so very important. It is such an interesting remedy and such important symptoms of peppermint that if you understand how to prescribe, you'll get very good results. For example, I told you one case where the patient was admitted in the hospital, the catarrh of larynx, and we could prescribe Seneca, which gave us very good results. In the same way, if you see pepper, mentha, one symptom of mentha that is so important, cough, it is written that cough from all kinds of smoke. Any type of smoke, if it aggravates the cough, think about this remedy. That is peppermint. Peppermint is a very important remedy when any type of smoke aggravates the cough. There are few remedies which are very given in comparison with that. One is Merxol, which I have used very good in my practice. Second is Staphysagrea, and third is methanol. But Merxol, Staphysagrea, and mentha pip, that is peppermint, is a very important remedy when your cough is aggravated by all kinds of smoke. Remember this remedy, a very important remedy when smoke causes aggravation of cough. The second symptom of peppermint that you should remember is the expectoration is lumpy like core of a boil. See, every boil has one core, and the patient will describe you, sir, whenever I cough, the expectoration comes like one lump, and that's all. It's like a core of a boil. It is written in a Mater Medica. And this is a very important symptom of peppermint. Do write down in your Mater Medica, because every time you have this type of expectoration, we think about Calcarea or Badiaga or Pulsatilla, lots of other remedies. But mentha, peppermint, it is lumpy like core of boil. These two symptoms are very important. One more symptom of peppermint cough is foggy weather. When there is a lot of fog, the cough aggravates. So when you are visiting a hill station and the patient classically comes and tells you, whenever there is fog, my cough starts, do think about peppermint. You have to compare peppermint with one more remedy when the fog aggravates, that is spongia, basilinum, and sepia. Because spongia is there, sepia is there, basilinum is there, we fail to prescribe peppermint. But these three symptoms and one more symptom of peppermint, which is common to lot many of remedies, and that is reading aloud aggravates the cough. You can compare that with important remedies like phosphorus or spongia, argentum nitricum, argentum metallicum, causticum, hyoscyamus, drosera, rumex, lot of remedies. But these four symptoms of this remedy peppermint, I have got very good results. First is write down in your Mater Medica, all kinds of smoke aggravates the cough. Reading aloud aggravates the cough. foggy weather aggravates the cough, and expectoration is lumpy like core of boil. These 4 symptoms are very, very important for peppermint cough. So one question is, sir, please put some light on trigeminal neuralgia. A very, very important and a very, very painful condition, trigeminal neuralgia. Whenever in practice, if you get these type of cases, and you should feel lucky that you are getting these cases, because treating these cases and giving this relief to the patient is very, very satisfying. In neuralgia, first of all, let me tell you whether I've cured cases of trigeminal neuralgia. I would like to tell you that I have cured cases of trigeminal neuralgia with very good results. In neuralgia, one thing you have to understand, do ask the patient the modality. I'll discuss here. Welcome Dr. Tanisha, Dr. Tripathi, Gaurav. There are few remedies which are very, very commonly used. In my practice also, I'll tell you the remedies also. That is phosphorus, rustox, veratrum, mercury, caliphos, calicarb, and colocin when there is trigeminal neuralgia. Now, I have found that modality is very, very important. Sometimes the patient comes and tells that I have neuralgia, and whenever there is cold wind coming, I get a lot of pain. And then you must think about sanicula. Yeah, welcome Dr. Vishaka. Then you must think about sanicula. One patient had came to me, he told me that, sir, I had herpes zoster. After herpes, I have got this neuralgia in the face, that trigeminal neuralgia, and the patient responded very well with Calmia latifolia. Very, very interesting, a very, very unique symptom, when the pain is after herpes zoster. Third symptom, whenever the patient comes and tells you that my neuralgia is aggravated during headaches, sometimes migraine the patient suffering from with neuralgia. In this, I have found a very, very important remedy, and that is queen's root. Queen's root, one potency I give normally, and I have got very good results in cases of neuralgia during headache. Queen's root is also called as, I think, Stellingina and Iris versicolais. These 2 remedies are very, very important when the patient says during headache there is neuralgia. Welcome Dr. Mayank. So these are basically some remedies and some symptoms which I have seen in my day-to-day practice, which I have got very good results. Okay. And then you can always think the type of pain, etc. Of course, that is also important, the type of pain, whether the pain is pressing type of pain, the pain has other symptom like pinching type of pain, the pain goes from the jaw, and also there are other symptoms also, but this is very, very important, So I hope some idea you got, Dr. Amit, and do take the whole case, and if you have, it will be very interesting to treat those cases. Yeah, welcome Dr. Palak. Dr. Vishal, Dr. Chintan Chawla. Okay, welcome. As we move forward, one more remedy, which is again very rare, and I've got very, very good results with that remedy. Do note down the symptom, because these are all the clinical symptoms which I've got in my practice, and I'm sharing it to you. Like peppermint, I told you, were a very, very interesting symptom, very, very 3-marking symptom. The next remedy that you all should remember in cough, acute cough, a rare remedy, the remedy is Lacnanthus. Normally, Lacnanthus is a good remedy for cervical spondylitis. But when the patient says that whenever there is cough, there is a bubbling sensation in the chest, you must think about Lacnanthus. Because bubbling sensation in the chest is also present in sepia, belladonna, lachesis, apis mellifica. That's why we hardly think about Lacnanthus. One very important symptom of Lacnanthus, there is boiling in the region of heart. There is boiling in the region of heart. That is a very, very important symptom of Lacnanthus. And if you get this symptom, there is some boiling in the region of heart, you must give once, at least try to Lacnanthus. This symptom has given me very good results. Welcome, Dr. Sharon. These 2 symptoms are very, very important symptoms of Lacnanthus. Okay. So as you go further, in Lacnanthus, there are symptoms also which are very, very common, like cough aggravated after sleep or cough during sleep. One symptom again I would like to share of Lacnanthus cough is cough from pain in the larynx. The patient says there is pain and then the cough starts. This is again a very, very important symptom of Lacnanthus. Why we fail to give Lacnanthus? Because it is again a very, very important symptom of causticum, basilinum, and aconite also. And there are few other remedies. But because causticum is there, we normally think about causticum. Also, spongia is there. So we think about spongia or causticum or aconite, but we fail to prescribe Lacnanthus. So Lacnanthus, my dear friends, think about whether there's boiling sensation in the region of the heart, bubbling sensation, cough aggravated during sleep, cough aggravated after sleep, and pain in the larynx from cough, or cough from pain in the larynx. These are very, very interesting symptoms and very, very interesting remedies, because once you give a single dose of Lacnanthus and you will see a very, very miraculous change of Lacnanthus. Patients are suffering from cough. So these are very, very interesting remedies. Of course, if you go to see cough repertory, you will have all the remedies of cough. But these two remedies, of course, there are some symptom of some remedy which are again very, very interesting. I would like to share one symptom or one remedy also, which I have been using now in my practice. Indigo. The remedy is indigo. Now, if you open Mater Medica, we have seen indigo where the patient complains about elements from what you call elements from sadness, elements from suppressed grief, elements suppressed anger. But indigo again is a very, very interesting remedy for cough. And one symptom of indigo which I have seen in my practice that you should remember, of course, there are cough symptoms also, but the weakness part, the weakness of indigo, the weakness from walking, weakness especially in the daytime, and a very interesting symptom of indigo is sometimes the patient says that when I walk, I feel better. A very, very contradictory symptom, but a very, very interesting symptom. And the cough of indigo is dry and epistaxis is important. There is cough which is dry and epistaxis is there. This is important. And a patient of indigo suffers from very dry cough after going to bed. When he goes in the bed, there is a lot of dry cough and there is vomiting. That these three symptoms of indigo I have seen very, very important in my practice. Of course, there are other symptoms also of indigo. Potency, normally when I start in cough, so I give 200 potency. Dr. Harshal. Dr. Farooq Master joined. So I hope these three, four remedies, you must be understanding. There are some remedies which are so rare, and we never think about, and because we're thinking about the remedies like causticum or hipparasulf or nitric acid or spongia or drosera, these few remedies which I have told you today, go home and read the symptoms again, and you will get a lot of good results if you use these symptoms and these remedies in your practice. And of course, go home and read this every day so that you don't forget this. One remedy which I have told you about cough, again, it's not a rare remedy, it is a very, very common remedy. But of late, I have been getting a lot of patients of these remedies. This is now winter has been starting, and so we have this. That remedy basically I'm thinking of telling you about is the squilla. Squilla, I had a case where I always told you about squilla, and this patient just came to me last week, and typical symptom as I always told you about squilla, patient rubs the face with fist during cough, and that is again a very, very interesting symptom of squilla, causticum and pulsatilla. Why I am repeating this squilla? Because this symptom of cough, have given me so many results in squilla, which sometimes we feel that maybe the boy is suffering from watering from the eyes, or boy is not well, he has just got up, or he is irritable, that's why he's doing it. But no, it is the typical symptom of squilla cough. One remedy, again, it's a common remedy, but we normally don't prescribe this remedy for cough. And that remedy which I'm sharing you is Macphos. McFoss remedy has a very, very interesting symptom, intercostal neuralgia. Intercostal neuralgia, and the voice is hoarse, larynx is very sore and raw, very, very close to causticum, Because of this, we normally prescribe causticum, but I had a case where I failed when I prescribed causticum. Then on deeper case taking, two symptoms I got very important. The voice was hoarse, the larynx was sore and raw, and there was intercostal neuralgia. And McFoss 200, two doses I gave, one in the night and one in the morning, and the patient was better next day. A McFoss cough, also remember one thing, that the McFoss suffers from spasmodic cough, difficulty in lying down. The patient cannot lie down. That's a difficulty in a McFoss patient. These three symptoms have given me a lot of good results in cases of McFoss cough, though a very, very interesting and frequently used medicine, but in cough. These are the symptoms which I have got in my patients and that have given me very good results. Yeah, welcome Dr. Sanagya, welcome Sarang Nayak, Dr. Anja. Yeah, so I hope you got some symptoms of cough symptoms that I wanted to share with you. Of course, now you can ask me some questions, because if I keep telling you about the cough remedies, it would take a lot of time. So can you share some questions, or some questions have been scrolled up both on Instagram and both on YouTube. So can we have few questions more? One question of neuralgia I've already answered. If you don't have, then I have to continue the cough symptoms, But you do ask some questions in your practice so that you can also learn and I can also learn, Can we have some questions? Or then again, one remedy which has given me very good results in cough, though it is not a very, very rare remedy, but it is very, allergic cough, sir, due to change of weather, especially in winter also. Now you will get a lot of cases where the patient comes and tells you that whenever the winter starts, I start getting cough. There is whenever there is a change of weather, I start getting cough. Sometimes, if you keep basically repetizing and prescribing on those same, what will happen? There are only few remedies that comes to your mind. The most important remedy, change of weather aggravates the cough. Do think about Dalkamara. Very, very important. Dalkamara. Second remedy that you should think about, change of weather, Rumex crispus. I had told you the cough of Rumex in my last YouTube live. Third, you must think about Spongia. Fourth is Cilicia. And fifth is Veratrum alb. These 5 remedies have given me very good results when the cough is in change of weather, especially in winter. Especially in winter. Nowadays, we have rains also in winters. We have in Nagpur. So the area becomes damp. So when there is damp, wet weather aggravation, Dalkamara is always there. But do add in your list of Matermedica calcarea carb. Do add Rustox, Natrum sulf, and one more remedy which is giving me very good result, and that is sulfur. So change of weather and change of weather from to damp wet weather, that is again a very, very important symptom that you have to take in for prescription. Those are very few remedies which I have shared, doctors, but there are a lot of remedies when the cough is because of change of weather. But especially in winters, use this remedy and you will get good results. Whenever there's change of weather and the patient complains of cough, you can have a lot of remedies like right from Bryonia to Phosphorus to Rustox to Cilicia, Soranum, Dalkamara, lot of remedies. Then differentiate from cold to warm, like from cold to warm. We have Bryonia, Soranum, Sulfur, Tuberculum, Kalisulf. Then you have from warm to cold. Then you have Dalkamara, Muxol, Veratrum, Rustox, Causticum. So there are different aspects of change of weather. This is what I could understand from the question. Hair fall from acute disease, do think about Soranum, do think about Carbovex, do think about Thallium and Timcrude. One question is on Instagram. When the patient is having cough aggravation more at night and pain in left knee side of throat, only when swallowing, stitching pain in cough leads to involuntary passing of urine, in just case which medicine? So a very interesting question and very precisely taken the case. So you must think about remedies like Muxol, Phytoleca, Rhododendron, Rustox and Cilicia. differentiate in those remedies. Good afternoon, Dr. Yasin. Doctor, please tell someone about sanguinary cough. Okay. Now, sinusitis after exposure to cold wind. Yeah. So whenever if you're prescribing for sinusitis also, I'll just come to your question, doctor, for sanguinary cough. I'll just complete this. Now see, whenever there is sinusitis because of cold weather, there are a lot of remedies, for sinusitis. But then whatever remedies I have seen clinically and I have got good results in my practice, I'll tell you. The remedies is calipachrome, the remedies silicia, the remedies thuja, the remedies dalcamar and colocynth. You can add calcarea phos also. So now we come to sanguinaria cough. See, sanguinaria canadensis, it is called as bloodroot. So whenever you are thinking of prescribing sanguinaria, of course there are so many symptoms in matermedica, but I'll just tell you what symptoms I take for prescription. In sanguinaria, the most important symptom that you have to understand, Dr. Yasin, cough of gastric origin. My dear friends, remember this sanguinary cough. Cough is of gastric origin, and that's why it is relieved by eructations. Cough of gastric origin and is relieved by eructation, a very, very important prescribing point of sanguinaria. Second, there is a lot of tension behind the sternum. The patient feels heat and lot of tension behind the sternum. Again, a very, very important symptom of sanguinaria. In sanguinaria, cough returns with every fresh cold. जब भी सर्दी होगी, जब भी कोल्ड होगा, पेशेंट को खांसी होनी है, and the patient must sit in the bed. The cough ameliorates. These symptoms are so important symptom of sanguinary canadensis. One symptom, the sputum of sanguinary is very, very tough. It is rust colored like phosphorus. It is offensive. And it is so tough that it is impossible to raise the sputa. This is a very, very important symptom of sanguinary canadensis. 4 symptoms which I have told you, very, very uncommon, very, very peculiar symptoms of sanguinary canadensis. Of course, you can go in the matermedica and see a lot of symptoms, but these 4 I have seen, very, very important. I hope I could answer your question, Dr. Yasin. Sir, in meanwhile, can we use Justicia? Yeah, you can use Justicia and Yerba Santa, very good results. You can add one more remedy, a Grindili also will help you in mother tincture. Sir, please tell about reeling vertigo while lying down. Again, vertigo, I think it seems to be a very difficult disease to treat, because every time in YouTube I get one of the questions of vertigo. So, vertigo on lying down. Remember, my dear friends, I've always told you, try to define your symptom. We have in cases vertigo on lying down, I'll tell the remedies. Then lying down on face, remedies different. Lying down on back, remedies different. Lying down on sides, remedy different. So first I'll tell you, whenever the patient lies down and it aggravates, think about conium, spigelia, rustox, thuja and lachesis. Very, very important. Of course, there are about 50-60 remedies, but these 5 remedies have given good results. Remember one thing, if the patient comes and tells you that I have vertigo when I'm lying on the back, 3 remedies very, very important: Merck salt, pulsatilla, silicia. But if the patient says vertigo while lying on sides, think about phosphorus, think about silicia, think about iodine. Especially when lying on the left side is phosphorus, silicia, iodine, and lying on the right side is again phosphorus, muriatic acid, gilcemium. So try to analyze the symptom, define the symptom very precisely, and then your prescription will be exactly the similar what the patient wants. Dr. Sir, role of mother tincture in cough. See, sometimes what happens that you are not able to prescribe the similem, or you can't get the symptoms. In that case, mother tincture would have a very physiological action and it will suppress the cough for some time. It will not cure it. So if you want some breathing time, if you feel that you're not getting the remedy, you can start some mother tincture, but still again take the symptom and prescribe in potency so that you are able to treat it better and cure it. Some mother tinctures which are commonly used, you can use Justicia, Adatoda, Aurelia, Grindelia. These are mother tinctures, Senega, Eucalyptus, very Yerba Santa, as doctor told. These are very commonly used mother tincture and they give good results. Sir, I have cough last 2 months and still not curing, even taking homeopathy medicines. Please, sir, any other good remedy? Yeah, all remedies are good, Dr. Zishan. And if you're basically having cough for the past 2 months, that means the disease is becoming subacute now. Try to get the exact case basically, and then we'll be able to prescribe properly, or try to get some symptoms, some PQRS symptom in relation to cough, so that we'll be able to prescribe. Okay. Which medicine can we think of when patient has symptoms of peripheral neuropathy, like sensation of thickness in fingers of legs, also tingling and numbness, more feeling of thickness when the legs is on floor? Yeah, peripheral neuropathy basically are symptoms which occur in diabetes mellitus also, and sometimes in vitamin B12 deficiency also. In this case, in old age also, there is arteriosclerosis also, then you can also have these type of symptoms. So first understand what is the disease condition and what are the symptoms to take for prescription. So because if you take normal symptom of the disease for prescription, you'll not be able to cure the complaints. So you must have some more symptom to prescribe. Vomiting of undigested food, as soon as the patient eats something, it nauseates, he will use power to stop it. He drank some water which relieves sometime, but he has to vomit relief. Yeah, very common symptom which is seen in case of phosphorus, in case of ipecac, in case of pulsatilla, in case of leptendra, in case of, these are the very common remedies that China, in case of, these are very common remedies that you should think about in these complaints. Yeah, welcome, Dr. Sultan. Patient has replaced knee joint, still has pain and staggering gait, goes out of balance. Yeah, basically when you have done already a knee transplant, there is staggering gait and pain. Go symptomatically. Some remedies which I have got useful is kali iode, guaicum, nigudium, Gualtheria, salicylic acid. These are remedies which can relieve the symptom temporarily. But if there is staggering gait, then the problem is then the constitution, or the operation might be have gone some wrong. That's why the gait is staggering. So make sure if it is then it's a staggering gait, take the whole case, then go to then prescribe the remedy. Meanwhile, in acute, you can give those remedy which I have told you. Yeah, welcome, Sultan. So these are the remedy. These are, I hope you got some idea about mother tinctures. These are also very important sometimes.
Check Instagram.
Yes. One question on Instagram has been scrolled up, so I'll just, yeah. Yes, I think I've answered that question. So as you go further, any other sinusitis from exposure to cold, I've answered. Yerba Senta is done. Justicia is done. Please explain Bryonia current viral. Yeah, again, very interesting remedy, Bryonia. And I know everybody, all doctors have basically what you call use this remedy more or less in your practice, but still sometimes, like in sanguinary canadensis, I told you that gastric cough, irritation, is emulation. Those are very interesting symptoms. In the same way, let us now study something about Bryonia, which I have found very useful in my practice. Of course, I'll not tell you that stitching pain in the chest and aggravation motion, better bearers. Those are very common symptoms, and you must know about Bryonia. Some symptoms which I have seen in Bryonia, my dear friends. Remember that a Bryonia patient has frequent desire to take long breath. That is Bryonia. He has to expand his lungs. That is Bryonia, my dear friends. Sometimes the patient is not able to describe the stitching pain, but this type of breathing you can see in the patient. Frequent desire to take long breath. Very interesting symptoms of Bryonia. Okay. Second, Bryonia has heaviness behind the sternum. And that heaviness from sternum goes to the right shoulder. I have seen in so many cases, heaviness behind the sternum, it extends towards the right shoulder. Like for instance, we have pain in the throat on swallowing, extends to the ear. In bryonia, heaviness beneath the sternum goes to the right shoulder. Again, a very, very important symptom of bryonia. Third symptom, bryonia cough is worse when he goes to the warm room. When the patient is sitting in the AC in your chamber, he said, whenever I go out of your chamber, no, I start coughing. That's a bryonia cough. Cough worse going into a warm room. Of course, if you have no AC in the waiting hall, then only you can have. Or you can say coming into a warm room excites the cough of bryonia. These three symptoms are very, very important, and the expectoration of bryonia is very tough and lumpy like jelly. You see jelly, you think about bryonia. So these four symptoms of bryonia cough, my dear friends, do prescribe bryonia on these four symptoms, because you will never miss that symptom in bryonia. Of course, there are other symptoms, but these four symptoms, what I can recall, are very, very important of bryonia. I hope, Dr. Mende, you got some idea. Dr. Vijit, you got some idea about bryonia. I have used all remedies, but there are still vomiting. Patient report shows fatty liver and all. So I think, Dr. Zainab, I think you should give me the whole case. It's a constitutional prescription we require in this case. Yeah, remedies for frozen shoulder. See, what happens, doctor? You have to understand that everything is not curable with medicine. In frozen shoulder, it is very, very important to do physiotherapy also. It is very, very important that the patient basically has to keep the sugar level at bay, because frozen shoulder, also called as encapsulitis, there is tendenza problem. So you have to think about remedies like thiocyanaminium. I have got very good results in elimpotency in repetition. The second remedy, ruta. Third remedy, rustox. And fourth remedy, again, sanguinaria. But these are the remedies which are very, very interesting and have got good results. But just make sure, if the patient is diabetic, he has basically diabetes under control, and the patient has to go for physiotherapy also. Okay. Yeah, thank you, Dr. Razia. Dr. Ruchi, welcome. In daytime, I have dry cough, and in morning, I have sputum cough like greenish discharge. Yeah, doctor. So, see, whenever if you are prescribing, okay, I'll give you some remedies where what symptoms you are giving, so that at least you get some idea. So whenever the patient comes and tells you that the expectoration is greenish, in the morning it is like this, in the evening like this, there are some remedies, doctor, when it is very, very important to understand and to prescribe. Of course, you must have taken all the common remedies. So do think about remedies. Calcarea silicata, sorinum, pulsatilla. I'm telling the rare remedies, Muxol, and one remedy, Paris quadrifolia. These are very, very important, and these are very, very interesting remedies. When symptoms, what you are telling me will correspond. Of course, there are remedies like calcarea sulfur, carbon sulf, mercury, lycopodium, Paris. But these 5-6 remedies suits your case very well. Are keloids curable? A keloid basically, there are certain if the keloid has some reason for burns. I've got a case where the keloid was because of burns, and we got very good results. Keloid because of trauma, very good results. Sometimes what happens after the operation, after the operation, the keloid marks. So some remedies which are very, very useful that I've seen in my practice is thiocyanaminium, graphitis, nitric acid. Very, very interesting remedies, Dr. Raju Mullah joined. Welcome. Cough was dry, cold air. How to search in the repertory? Dr. Abhijit, I have basically given you the answers from the mathematical knowledge I have seen. I think you must use Murphy's repertory. In that, it might be given frozen shoulder. I think rubric must be there. So one symptom, cough was dry, cold air. Now see, if you have seen cough, dry, cold air, see there are a lot of remedies. Give me some more symptom to prescribe. Yes, some more symptom. Doctor from Kunakala joint. I hope if I'm sorry, I couldn't pronounce name properly. Cough from dry. See, if you have remedies for cough, then there are a lot of other remedies you can think about. For example, I'll tell you the remedies. You can think about remedies. See, in cough, there are so many remedies. You can think about simple remedies. You think about Drosera spongia. You can think about aconite. You can think about phosphorus. You can think about lycopodium. You can think about there are lots and lots of remedies. Always make sure that you are basically defining that symptom very precisely. Then it will be very easy to answer. Otherwise, cough with the repeatedly, you have a soreness of chest, acidity. See, you can have from A to Z for everything from soreness of chest and all. But some important remedies that are very, very interesting. You must think about simple arnica is there, rustox is there, robenia is there, leptendra is there, china is there, ranunculus bulbosus is there, macphos is there. But again, the soreness has to have some cause. Acidity also, as I told you, the things which we are not able to digest in the mind causes more of acidity and also. That's why you think about that also. So I think most of the questions are answered. It's already 3:40 and I'll take your leave from today's live. LM potency I'll discuss next week, next YouTube live. So everybody, happy Diwali and I hope you enjoyed it and enjoy your Diwali. Next time, next Saturday, we'll again come back with the next session of YouTube live. Thank you so much.